Hey everyone, and welcome back. We're ready for a deep dive today, and you guys sent in some interesting stuff, all about gender reassignment surgery.
Yeah, specifically for male to female transitions in India.
Okay, so before we get too far, we do have to acknowledge that a lot of people seeking these surgeries, they're doing because they experience gender dysphoria.
Right, which basically means their physical body doesn't match how they feel inside, their internal sense of gender identity. And that can be a powerful motivator to seek out life-altering surgeries like these.
Absolutely. So let's kind of unpack how this whole transformation journey works, at least according to this source. They lay it out step by step, starting with, well, it makes sense, breast augmentation or implants.
The goal there being to create a more feminine, chest contour.
Okay, that makes sense, but then it gets more, I don't know about intense, but definitely more involved. They mentioned penectomy and orchiectomy.
Which is the surgical removal of the penis and testicles.
Right, exactly. Then we move on to vaginoplasty.
And just in case anyone listening isn't familiar with the term vaginoplasty, it refers to the surgical construction of a vagina. It's, well, as you can imagine, very specialized.
I can only imagine.
Extremely. And this source actually highlights how they work to preserve sexual sensation, which is a really important consideration for obvious reasons.
It is. They even mention using existing tissues to create a clitoris, with the goal of allowing for orgasms after. I mean, it's very interesting how they really want to address a potential patient's concerns about intimacy in their future. But then, just when you think you've got a handle on it all, it gets even more complex. Facial feminization surgery, FFS, that's broken down into all these sub-procedures. We're talking rhinoplasty, forehead reconstruction, even body contouring.
Like, whoa, it's a lot more than just one surgery. It's a whole series of procedures, each with its own complexities.
It's pretty wild. And then, almost like they're leaving us hanging intentionally, they briefly mention voice feminization. But they don't actually go into detail about what that entails at all.
Feels almost like a cliffhanger to get you hooked, you know?
Right. Like, to be continued. And speaking of things that make you go, this source, with its tagline, Best in India, it really seems like they're trying to attract international patients. So why India specifically? Why do you think they're targeting people outside of India for these procedures?
Well, there could be a few reasons for that, right? A lot of times. And procedures in countries like India, they can be way cheaper than places like, say, the US or Europe.
Oh, for sure, especially for procedures that might not be covered by insurance everywhere. I mean, that could be a huge deciding factor for people. But it can't just be about the cost, right?
Oh, absolutely not. There's a lot more to it. I mean, there are differences in waiting times, how the whole thing is regulated, just the overall process. It might be easier in some ways to have these surgeries done in India.
That makes a lot of sense when you put it like that.